Good afternoon, folks. Welcome to Book Bites. We're delighted to have you here as we talk about another book produced by one of our faculty members, Dr. Karen Mason. Dr. Mason has published a book from InterVarsity Press called Preventing Suicide, a handbook for pastors, chaplains, and pastoral counselors. Would you please welcome Dr. Mason to our time together?
Thank you.
This is an important topic, and Dr. Mason is going to help us to understand its importance as we engage in our time together. Book Bites is a conversation with our authors about books, and one of the questions that I'd like to begin with, Dr. Mason, is what was it that got you to become interested in this topic of suicide?
Mm-hmm. Or suicide prevention.
Mm-hmm.
I think the time that I hearken back to or remember was sitting in a session with a client who had struggled with suicidal thinking all her life, every day of her life. The first memory she has, actually, of being suicidal was when she was 3 years old. So, you know, and this was a woman in her 50s. And I remember her, it finally just kind of hit me, oh, she wants me to help her not kill herself. And I think that was the first time that I really started to get interested in suicide prevention. You know, I don't think we talk a lot about prevention, suicide prevention, and so I don't think I had thought about it a great deal. You know, as a psychologist, I felt like I had a certain professional commitment to preventing suicide, but I don't think I'd really thought a whole lot about how you do it.
So you were introduced, in fact, in the introduction, you bring up that case,
Mm-hmm.
And you were introduced to this, so where did it go from there?
So, interestingly, I was working at a very large mental health organization in Denver, and the state of Colorado was implementing suicide prevention training for mental health professionals, and I happened to be the director of training for this organization, and I was looking for people who could go to this training, and it was in August. And everybody was on vacation. So finally, I went. And I thought, well, and I just became really interested in the topic at that point in time. So I had the clinical side of the experience, and then I had the training, and it just became very interesting to me.
So then, that took you to another level of suicide prevention.
Mm-hmm. I actually ended up working for the group that had instituted this training. I was managing the Office of Suicide Prevention for the state of Colorado, and that's when I first started hearing about clergy as partners in suicide prevention, and that was really interesting to me, because being a person of faith. You know, what do clergy have to do with suicide prevention? And nobody had written a whole lot about it. And so I was thinking, now when I get to Gordon-Conwell, that's what I'm going to research.
So you were introduced to this client, moved into some training, and then became the director of the suicide prevention program. But also, you had, in addition to the clinical training and the experience of training and then becoming the director, you have the background in your own seminary training, ministry training.
Absolutely. So, you know, I'm a seminary graduate also, and have always been so interested in the integration of my faith. I mean, you know, in college, you have to integrate your faith with learning, and in seminary, always thinking about that. In grad school for psychology, always thinking about how you integrate faith with learning. It's the foundation. Faith is your foundation, but how do you understand everything that's going on around you?
So
here's the book.
Yeah.
Yeah.
So tell us how you started to map out the book and what you thought to include, what you didn't include as well.
Mm-hmm. So another experience that shaped this book was my first couple years here at Gordon-Conwell. Actually, Lily through the Association of Theological Schools, gave myself and Dr. Pendleton and Dr. Polishchuk a grant to do some interviews with clergy. And as part of that grant, we put on a suicide prevention training for clergy. And I remember, you know, photocopying millions of photocopies. I'm exaggerating, of course, but just realize.
Don't worry about that in terms of the.
I know, I'm sitting here thinking, I shouldn't be admitting that, should I, actually? That was back before we were watching copies. We would put those online now, but back then we were, right. I was making these copies and realizing, you know, clergy don't have a resource all in one spot. And that's when the idea of a handbook came to mind. That, you know, I get asked questions a lot. I was very intrigued in the research, you know, what do clergy do when suicidal people come to them for help? Clearly they're engaging this issue of suicide in faith communities. We know that from the research, 25% of people with any kind of mental health problem are going to go to clergy rather than a mental health professional. And suicidal thinking, attempts, and plans are some of the predictors for why people make contact with clergy. So all of a sudden I'm thinking, wow, what are clergy doing with this very challenging situation? So in the process of doing seminars and realizing that there really wasn't a resource, that's really where the book grew. Mm-hmm. You know, this idea that, and the subtitle is it's a handbook, and it really is. You know, I'm really hopeful that it's just a resource that's very usable for clergy.
So as you begin the book, you provide this wonderful introduction, giving a scenario of this very patient whom she first deals with, and then walk us through some of the things that you include in the book in terms of the chapters so that folks can get a sense as to the landscape of this handbook.
Mm-hmm. So initially in the book I talk about attitudes, different attitudes that people have towards suicide. I talk about how I think these societal attitudes about suicide affected me in how I was working with suicidal people. That maybe there are times when it's okay for a person. You know, I mean, you hear about suicide in Sophocles and Shakespeare and so on and on the news. And, you know, a Buddhist monk immolates himself, you know, in Saigon. And you have all these images about suicide. And I felt like I needed to really sort through some of those attitudes. So I talk about some of the attitudes. I talk about definitions. I then talk about who dies by suicide, because I think that the answer to that question is sometimes surprising to people. I talk about myths. One of the things that Christians always ask me is, do Christians really die by suicide? So I talk about that particular myth. I talk about the theology of suicide. I think one of the things that has really struck me talking to clergy is how nuanced theologies of suicide are, so talking about some of those aspects. And then I take people through, here's what you do for a suicidal person. Here's what you do after someone has attempted. Here's what you do for family members. Here's what you do following a suicide. Here's what you do in a community. But the sort of bookends of the book are really trying to engage clergy around the fact that they play such a crucial role in suicide prevention. I am 110%, I'm given to exaggeration clearly, but I am 110% convinced of that. And so the bookends of the book really are trying to bring clergy into the aspects of suicide prevention that I think are just so important for people and very definitely important in faith communities and for people of faith.
So what would you say then from your work and as you spell it out in the book, what would you say are some of the myths about suicide?
Mm-hmm. I think, you know, I'll just pick one sort of small basic one just because it's easy to talk about, and that's that suicides happen always over the holidays. They actually don't. Most suicides happen in the spring. So there are some real kind of easy ones to dispel like that in terms of just looking at the basic facts. There are other myths like people who kill themselves are just selfish, or people who are depressed should just snap out of it. And as I mentioned, one of them is just, do Christians really struggle with suicidality? Suicidality just being the whole range, from suicidal thinking to suicidal behaviors.
And do they?
And I believe they do. So, we have a number of examples. I have to say in my own practice, I can say without a doubt the answer to that question is yes. But just in case you want more than just my experience, my anecdotal experience, Frankie Schaeffer, the son of Francis Schaeffer, writes about his father who struggled with suicidal thinking, writes about Francis Schaeffer. We know that Edward J. Carnell writes about the suicidal thoughts that he had over his life in his book that he wrote on Christian commitment. We have examples of Dr. Jim Stout, who came and visited us this last fall. He writes about his suicidal thinking. Kathleen McCrate, who's a theologian and a priest, talks about her own struggles with suicidality. So there are many, many examples where Christians do, in fact, write about struggles with suicidality.
Well, how about suicide prevention, suicidality in Christian theology? Can we talk a little bit about that?
Just some of the nuanced
Yes.
theology that
Yes.
Christians bring to this. So, in fact, that was one of the things that really surprised me as I started talking to clergy about this issue, just that there are a spectrum or of views or nuances that Protestant clergy bring to this issue of suicide. And I think most of us think about the historical Catholic view that everyone who dies by suicide is damned to hell. That's sort of a default view that I think a lot of us bring to this issue. The truth is that the Catholic Church, if you look at the Catholic Catechism, that's actually not their current view. So they actually have nuanced that quite a bit in terms of understanding the mental health issues, or bringing in an understanding of some of the mental health issues that complicate this particular issue and talk about diminished moral responsibility, but in the Catholic Church, they do believe it's a sin. But there are a number of views you can read about where different Christian theologians have talked about not believing. There are evangelical Christians out there who believe that suicide, in fact, is not a sin for a variety of reasons. Suicide is usually associated with mental health issues, so some Christians are going to look at that mental health issue as completely mitigating moral responsibility for this decision, looking at this sense of the fact that this person was overcome, in a sense, by their suicidal thinking. Surprisingly, John Donne in the 17th century wrote a whole moral treatise on suicide. He talks about reasons why a Christian might even think about suicide. For instance, if you're at risk of not following God, that might be a situation, which I found a little surprising to read about that. In the early church, there was a real zeal to leave the world, and because of that zeal to leave the world, there was a confusion about what's different between martyrdom and suicide, and Augustine was the first one who really made that distinction and said, no, there's a distinction between martyrdom and suicide. So there are certain views. Some Christians will also argue when you read through the suicides that you find in the Bible. So, for instance, Ahithophel, the counselor to Absalom, his counsel is not taken, it's not followed. He goes home, puts his house in order, and hangs himself, and is buried in the tombs of his fathers, right? So one of the things that some Christians argue is that because of that, there isn't a clear statement about the sort of moral impact on this decision to kill himself. However, you're going to find other Christians who say, look, you know, clearly these narratives don't turn out well. Clearly this is not a condoning of the act of suicide. Others are going to argue from the Sixth Commandment. Augustine was the one who first said, look, it says thou shalt not kill, and it doesn't say thou shalt not kill your neighbor. It just says thou shalt not kill. So clearly it is not right, and in fact it's a sinful act to kill oneself. Aquinas follows, of course, along that vein. You have Calvin, who believed, you know, in the sanctity of life, that in fact none of us gets to make that decision about when we come into the world or leave the world. So those folks would follow in that vein that suicide, in fact, is a sin. You have others who nuance that by saying it's a sin, but it's forgivable. So, you know, there doesn't seem to be a distinction about murder being a special class of sin in some way. So you have other Christians who will argue that it's a sin, but it's a forgivable sin. We all, Lewis Smead said, we're all too spiritually cloddish to recognize everything, all the sins that we commit as being sins. So clearly we all commit sins that we don't recognize as sins, and somehow in the loving nature of God, somehow that God sees the fact that we're not spiritually able to recognize everything as sin. So different Christians will argue in that vein. And then we have some who argue that it is an unforgivable sin, and in fact that it eternally damns you. So there's one of the things that has just surprised me about talking to clergy about this particular issue is just the breadth of nuances regarding this. I think one of the real challenges too for clergy is talking about to a suicidal person, what is your moral perspective, but then talking to maybe a family member following a suicide. How do you talk about that? And that can be very challenging theologically.
And that's where we want to take a little bit of a turn and talk about the matter of suicide prevention, what pastors can do with regard to somebody who is suicidal, or even in the aftermath of a suicide, dealing with it. Maybe you could talk about what are some concrete ways that you've discovered through your work that pastors can do in order to work alongside mental health care professionals and others to prevent suicide.
Mm-hmm. I was going to say that's most of the book. So how do I?
Well, what would be some key points that to keep in mind?
Okay, so one key point I'll focus in on here is, you know, and just backing up just a little bit, one of the sort of main theories on suicide right now as to why people start thinking about suicide is that one of their basic human needs of human belonging isn't being met. So he actually, Thomas Joyner, the person who has developed this theory, talks about the importance of belonging, but also the importance of feeling competent, of feeling like you're contributing. I think those are two clear places that clergy can engage this issue. So in terms of belonging, I just can't imagine a faith community that isn't concerned about helping people feel like they belong. I also can't imagine a faith community where clergy aren't concerned about helping people use their gifts and contribute in meaningful ways to that faith community. And I feel like those are two clear places where clergy can engage this particular issue. Now, let me just share with you one little but a very important research study that I think illustrates this belonging piece. So there was a researcher named Jerome Motto who followed a bunch of patients who were discharged from a psychiatric hospital who had been suicidal. So he followed one group that refused treatment, and they just left the hospital. He followed another group who wanted to get treatment. So he followed that group who were receiving outpatient treatment. And then he took this other group who refused treatment and actually sent letters to half of them and said, and the letter was very simple. All it said was, "Dear so-and-so, it's been a while since we've seen you at the hospital. I hope you're doing well. And here's a self-addressed stamped return envelope if you want to send us back a note, and we'll correspond with you." That's the group that did the best in terms of reducing suicide numbers. So they had refused treatment, but just the act of getting a letter. To me, this is just stunning research that argues for the place of the church in suicide prevention. I mean, if writing a note can make that big of a difference, then, you know, faith, this is a place for clergy and faith communities to be involved in suicide prevention. I mean, that, to me, that is stunning research that just, I hate to be redundant, but argues for the place of faith communities.
Well, then, one thing that pastors can do is to cultivate a place of belonging for people where they feel that they are part of a community. Any other kinds of insights that pastors will want to be aware of cultivating belonging and engaging with people in what other kinds of ways?
Mm-hmm. So I think real. I just think that creating Christian community. I don't know if this might be where you're heading, but I think creating Christian community is something that's clearly spoken about in the Bible, and that figuring out how to create a community, as Dr. Arthurs was talking about in chapel, can be really challenging. So there's the potential for conflict. There's the potential for people not having the interpersonal skills to be able to engage complex social situations. I think churches allow people to develop those kind of skills. I think they present them with those opportunities. And I think that's part of how churches are involved in suicide prevention, is giving people the opportunities to really develop skills around managing interpersonal relationships, giving them opportunities to practice those, but also providing them with moral, in a sense, standards for how those relationships get developed. So, I mean, I'm thinking about Matthew 18, that there's a prescribed mechanism for how you're going to approach some of that conflict. That comes from the Bible. I just think that there are so many ways where clergy and faith communities really can build community and help people figure out how to do that successfully.
What about then on the other side, where pastors walk through with a family the grief of somebody committing suicide? When I was probably 16 years old, my aunt committed suicide. And come from a family of very little connection with the church. And there's an old Presbyterian pastor who conducted the service. And afterwards, I went up and spoke with him and told him that I was a believer. And he shook his head and he said, "This family has such great need, but I don't know how really to help them." Mm-hmm. And I just felt the sense of loss, for my family had no hope. And how do you address the scattered emotions that a family has after a suicide? How can a pastor come in there and address the needs that they might have?
Well, I just think, the ministry of presence that clergy provide to people in all times of distress, but specifically we're talking about following a suicide death. I just think that's so crucially important. And it's something that other professionals don't do. So you don't find many more professionals walking with families through these difficult moments. And I think that is a crucial way that clergy are involved in these situations. And faith communities tend to come around people in difficult moments. Now, by the way, because of the stigma of suicide, I think that not all faith communities are created equal on this one, and sometimes faith communities do better than in other situations that don't involve such a stigmatized event. So I think clergy have the possibility of really leading the way on this one. Now, ultimately, the decision about whether to talk about this as having been a suicide is up to the family. That's the family's decision. But the clergy really has the opportunity to provide leadership here in terms of not tiptoeing around the subject as the family is open to that, and actually addressing that particular issue, talking about how we as a community can come around this family in such a difficult time. I think also people have a tendency to avoid, the issue of suicide seems so scary for people. Like, what do you say? So people in the congregation might tend to avoid that family member, or they might judge them. Clergy really in those moments provide that leadership around what that faith community is going to do for that family. There's some research that about 80% of people following a suicide leave that church, might go to a different one, or might leave church totally. And I think what happens in those moments is important.
Yeah, there is such a stigma that surrounds this matter of suicide. And if the pastor is able, even at the funeral itself, having permission of the family to, in a sense, name what happened, it brings it to a more comfortable yet uncomfortable level. That's with any type of funeral, but if you're able then to deal with it honestly, lovingly, compassionately, it does help. And as you note, people don't necessarily know what to do inside the family with it, whether even outside the family. How do you navigate those waters?
Yeah, I mean, your mom never sat you down and said, here's what you're going to do in those situations, right? So, yeah, I mean, it's incredibly challenging for the family, and I think the family looks to the clergy person, too, to help them navigate this through these difficult moments. I think, too, what the clergy person does in those moments, too, could have a big effect in terms of people down the road being willing to come ask for help around suicidal thinking. It unlocks the door on some level for people to then feel free to come forward and talk about the issue of suicide in a larger kind of way. Not just suicide deaths, but suicide in the whole gamut of it.
Well, your book begins with defining suicide and then goes through towards the middle part and beyond this very helpful structures of how one goes about assisting folks with the matter of suicide prevention and helping a survivor, helping the helpers. These are really solid chapters that are typical of a good handbook. Maybe what we could do here is to open up for some questions that you might have for Dr. Mason. This is a very important book, and a very important that will come into your focus when something like this takes place. But if there's a way in which suicide prevention can be part of the ministry of the church, that's really what you want to think about. So.
Yeah, I was just, may I just interject something, and then we'll get to your question, Sam, or your comment. I hope you never need the book, but I rather think you might at some point. So 66% of the clergy that we've been, we did a large survey of 801 clergy, including Catholic, Protestant, and Jewish clergy, which is why I always use the word clergy instead of pastors. But and 66% of them had been approached by a suicidal person. On average, they had experienced 3 suicide deaths in their professional experience. So, unfortunately, you might want to just be ready for that particular perspective. But also, before we get to questions, I also just want to say what Jeff did today was such a great example of what clergy can do in suicide prevention. Because, I mean, basically he's talking about nurturing hope in ourselves and nurturing hope in our congregations. And one of my next projects in cahoots with Dr. Gibson here is writing a book about preaching that prevents suicide. And I just want to say, and I didn't know where you were going to go with the question, so I didn't say it earlier, but some of the things that you can talk about in preaching are just those incredible narratives of hope. For instance, in 1 Samuel 30, Dr. Arthurs was talking about David being just totally distressed, but finds his hope in the Lord. And I think what's so fascinating about biblical narratives of hope, not all of them, but I mean so many of them, they start in horrible, horrible places, but end up with, but my hope is in the Lord. And I just think that's so unique in the biblical literature, and something that you as clergy can really focus in on that helps prevent suicide. I just felt like Jeff's message today just was a perfect example of what clergy do to prevent suicide. The other piece, by the way, that he did was he talked about how to manage suffering. And one of the things we found in our interviews is that probably the question that gets asked most of clergy isn't, if I kill myself, am I going to go to hell? Certainly that question has come up for some clergy, but what comes up more is, why isn't God giving me joy? Which is basically a theodicy or a suffering question. How do I reconcile a loving God with, the suffering that I'm experiencing? And I thought we were going to be too blessed to be depressed. So what's this, And just trying to negotiate their way through that. And I think Jeff's message was just right on, and such a perfect example of how preaching can help prevent suicide. I was just particularly struck by that.
Sam?
Well, I actually think that you might have already answered the question I'm about to ask just now, which was, as pastors or ministers, we also have to be humble enough to discern sort of our place or role in the system, or the prevention of suicide. And since your book is about prevention, and I hope to read it very soon, but I haven't read it yet. So how far upstream, realistically, should the clergy go up with respect to prevention? For example, most of the things that we talk about, even though we call it preventive, is actually kind of a downstream prevention, right? If somebody comes up to me and says, I want to kill myself, what do I do? That's like, how do I react to this situation? But I think, the way you talked about Dr. Arthur's sermon today, does this book talk a lot about some of the further upstream points? Like, for example, in your Myth and Truth about Suicide, it gives us indications of, there are certain combinations of events, dispositions, life changes and things that may disposition somebody more towards moving toward that direction and so on. do the clergy need to be at a point of vigilance where we need to be cognizant of that and be aware and create a culture that within our own community that is also looking out for those kind of things? And then, even further up, you mentioned the research about sort of a community of hope or a sense of belonging. Is that really what we ultimately need to be doing, is to try to change the culture of a community toward that belongingness, that care, and that hope? And is that where we may be most effective in preventing people from getting to the point of coming to you and saying, I'm thinking about suicide?
Mm-hmm. So I mean, you asked lots of questions. So I'll pick a few in there. So one of the things to think about is this. What you just brought up, Sam, is absolutely right on. There's prevention, intervention, and postvention, right? And prevention is absolutely upstream. So if you were trying to prevent drowning, right, prevention is you build the fence around the swimming pool, right? And intervention is you pull those kids out right away, right? Postvention is what happens after the unfortunate event happens, right? So my belief is that clergy actually engage this issue right through the whole gamut. So in my opinion, prevention is that preaching that prevents suicide, the creating of the community, right? The community that's willing to talk about a difficult issue. So prevention is what happens upstream, and I like your word upstream a lot. So that's the upstream part of the clergy contribution to suicide prevention. Intervention is when suicidal people come to you for help, you help them, right? You figure out how to connect them, and I wasn't sure if part of your question was, what's my role in this, but because of the close connection between suicidality and mental health disorders, my opinion is you want to continue to provide the spiritual supports because people aren't going to get that in the community. So you continue to provide the spiritual supports, but at the same time, you refer them for mental health treatment. Now, postvention is what Dr. Gibson was talking about earlier, which is that question of what do you do following a suicide? And there's tons of evidence that there is a risk of contagion, that in fact you might end up with copycat suicide. So how suicide gets talked about in a memorial service is crucially important, right? And we know that from the literature, that how, for instance, the press reports on suicide. And I'll tell you, if you want to know what not to do, just kind of think about Robin Williams, all the press on location and method and all that stuff that you're not supposed to do. And that's all postvention, right? What do you do following a suicide? So in my opinion, clergy would have a hard time compartmentalizing and saying, well, I'm only going to work in intervention, or I'm only going to do the preaching that prevents suicide, or in creating the community, right? Or I'm going to only, make sure this community doesn't experience copycat suicides and experience contagion. So my opinion is that clergy work the whole gamut, and that's why I'm so convinced of the importance of clergy. I picked out just a few of the questions.
Thank you so much, Karen, for writing this book. I wonder if you could just say a little bit more about causal factors in suicide. I think that a lot of people assume that it's primarily related to depression and hence approach from a purely psychological model. But Emil Durkheim was one of the first to write a major work on suicide in modernity, and he attributed it primarily to what he called social anomie, the sense of social dislocation occurring in societies and cultures. And can you comment on that? I mean, it just seems to me that as we think about this issue, having some sense of the cause is important. I deal with this as an ethicist in bioethics with the push for a physician-assisted suicide. And those opposed to physician-assisted suicide, as I am, often note that the push is largely driven by people who are alone at the end of life, who don't have a social network, who may indeed experience something akin to what Durkheim called social anomie. So just be interested in your take on all that.
Yeah. So there are many theories out there around, what are the factors that create risk or vulnerability to suicide. So Durkheim was one of the, there were actually some folks even earlier than that who connected it with depression and that sort of thing. But Durkheim did talk about that his perspective is that people all have this, these desires to think about suicide, and it's the society that creates the structures that prevents people from acting on it. So societies can either be too rigidly structured or not enough rigidly structured, which is that anomie I think that you're talking about. And by the way, he also said that's why Catholics don't die by suicide as much as Protestants, because it's more of a closely regulated kind of, which hasn't really panned out in the research. The research is more that moral objections to suicide, which, by the way, is something that clergy bring to it's that intersection of theology and practice, that practical theology place that that I feel like clergy are really infusing what's really important here, which are that discussion around moral objections to suicide. And there's, I have to say, there's even more nuance when it comes to physician-assisted suicide, I've noticed in talking to clergy. But so where the literature is leaning at this point in time is really looking at more of a public health model, which basically looks at the risk and the protective factors. So what are the risk factors? And then what are the protective factors? So I can just kind of read through some of them. And some of the risk factors are things that we've talked about, like social isolation. But by the way, childhood sexual abuse really increases risk. Intimate partner violence very much increases risk. Any kind of conflict. So if you work with teenagers, adolescents, conflicts with parents is hugely important. So any kind of teaching you can do to help kids figure out how to negotiate conflict is suicide prevention in my mind. Owning firearms is a huge risk factor. So anytime you're working with somebody who's suicidal, who actually owns a firearm or owns the means by which they might think about harming themselves, you want to take that away, figure out how to take that away. Economic recession has been found to have an association, but at the same time, there are many other aspects that might be a little bit stronger, like chronic pain. Of course, being a veteran, one of the issues is exposure to violence or learning to face death, sort of getting desensitized to death, that sort of thing can also create risk for a person. Immigration, interestingly enough, kids who struggle around sexual orientation issues, all of those would be risk factors. But then what you want to be able to look at is, in a sense, the balance of or the weighing of risk factors with protective factors. So protective factors would be things like people using their faith to deal with suicidal thinking. It's going to have that sense of belonging or have those social networks, have that sense of meaningfully contributing to a particular group of people, support from others, church attendance, having moral objections to suicide, having reasons for living. And I feel like that's pretty much what my faith gives me, is reasons for living. Coping strategies, having children, those sorts of things. And I think you've both said this, it's very complicated. There's not going to be any one factor that, in a sense, pushes a person over the edge to deciding to take their life. Mental health issues are very much related, but of all the people who have mental health issues in the United States, which is 1 in 5 Americans has a mental health issue, only 3 or so out of 10 are going to be the ones who actually kill themselves. So it's not a one-to-one correspondence in terms of having a mental health issue and then you die by suicide. The biggest predictor actually that we have in terms of who dies by suicide is somebody who has attempted before. That increases the risk by 40 times. That's your biggest issue. So somebody who has attempted beforehand, those are the folks you want to be concerned about.
Let's take one more question here.
I think suicide as a phenomenon it's not like a local problem, but a global problem. So, but sometimes it's quite interesting because I think I read data from WHO that there are like 800,000 suicide happen all over the world, but there are like 270,000 in China. So where I come from, and there's a typical problem in China because according to Durkheim, from his sociology study, suicide typically like a male, urban, and mid-aged phenomenon. But in China, it's totally different. It's like a female, rural. Yeah, and old. So I think it's very interesting because when we study about the topic there from a sociology, it seems that it's a very culturally distinctive problem there. There's some like contextualized problem maybe in a family or in a society. So how can we build a theology from a different context? Is the prevention solution a quite cultural solution or like a universally universal solution for each culture there?
So your question is, would the interventions be different depending on the country where you're intervening, right? So, China is the only country in the world actually where more women die than men. So in every other country in the world, more men die actually than women, although more women, by the way, think about suicide and attempt suicide. So, and there have to be cultural aspects to this, right? So we know, for instance, and a lot of the research that I'm familiar with, especially has been done here in the United States, but things like having a strong sense of identity within your culture can, be a protective factor, but not having that could also be a risk factor, right, for a person. So there have to be culturally based interventions as we think about this particular issue. There has to be. And a lot of people are concerned about the suicide rates in China because of the higher female rural rates, the accessibility to poisons and that sort of thing in rural communities, that sort of thing. So it's definitely a challenge, and I don't know if we have the answer to that yet.
Well, it's been really rich for us to be able to have a conversation about this very important book. Will you please join me in thanking Dr. Mason for sharing with us today?